am Dr. Katie Novak, and I am here to talk about the importance of building a multi-tiered system that is not just focused on location. And to do that, we're going to introduce a dental analogy. Now, I have to admit, I am not a huge fan of the dentist, never really have been, but you know what? I have to go to the dentist. Everybody has to go to the dentist. The dentist is like the tier 1 of teeth care, right? Because you have a dentist who's going to be very proactive and preventative and teach you how to brush your teeth and make you floss. And it's very database decision making as well, because they use a lot of universal screening and diagnostic tools to ensure that, if you need targeted intervention and support, you can definitely get that. So, their diagnostic tools are very evidence-based. One is the X-ray. We're all familiar with the X-ray. And then the other is that terrible thing. It's like a pick, it's a metal pick, and they shove it in your teeth. And then they know if there's holes there, okay? So think of all of us as tier 1 dentist patients, and that's fantastic. And then we get our X-rays back, okay? Now, my X-ray shows that I have a cavity. Now, here's the thing, is the dentist, who in theory is a tier 1 practitioner, is very, very skilled and capable at filling that cavity, him or herself. And so what we want to talk about is a tier doesn't necessarily have to be a different place, and it doesn't have to be a different person, okay? And it has nothing to do with any sort of label, okay? I can receive that cavity whether I have a very healthy set of teeth with just a little hole, whether I have a cleft palate, whether I have braces. So a dentist really treats all dental patients and then provides, again, very frequent progress monitoring to ensure that when there is intervention and support needed, that support is given. Now, sometimes you end up going to the dentist and you get the X-ray and the dentist says, oh gosh, you are going to need a cavity, but you're also going to need braces because it's really going to affect your bite, it's going to affect your breathing, and now I have to send you to an orthodontist. Okay, great. But guess what? You don't stop seeing the dentist. So in this point, I'm like a tier 1 dentist patient, and then I'm also going to the orthodontist for tier 2 targeted support. Now, here's the important thing about that. That does happen to be a different place, and it does happen to be a different person. But that is not a life sentence, because what the orthodontist is trying to do is to get the braces to come off, okay? It's a long-term plan, constantly looking at data, constantly taking X-rays, and then deciding when it's more appropriate for me just to be back in tier 1. Now, I never stop tier 1. So all students are tier 1 students first. We want general education students to be tier 1 students. We want to build a multi-tiered system so that tier 1 environment is the least restrictive environment to try to get all students to learn together. Again, we focus on universally designing our academics, our behavior, and our social emotional learning in those classrooms to eliminate the barriers that prevent all students from learning. And then when we have a robust system of screening and progress monitoring students, we will have some students who are going to need some additional support. And to do that, they may need tier 2 services. Those tier 2 services may be done in the classroom by the classroom teacher in the form of accommodations or modifications. They may be done in a different place, but it's in addition to and not instead of. And it may be done by a different person. But really interestingly in this dental analogy is the dentist and the orthodontist are now collaborating. Now they're team members, and they both have these brilliant area of expertise. So when you're thinking about your speech and language pathologists and your physical therapists and your special educators, they're still working together and sharing data and having conversations about students, because all students are all of our students. Now, let's say that I am a tier 1 dentist patient, and then I also am in braces, and then I get this terrible infection. I need a root canal. Now I'm actually going to 3 different specialists, but here's the thing is, it doesn't make me a tier 2 dentist patient. It doesn't make me a tier 3 dentist patient. At the time, I need additional services, and so I get them. And that's what we want to build in our school. We want to build a school and a district so that all students can get what they need when they need it, and it might be in a different place, and it might be in a different person, but it doesn't have to be. All that has to happen is when I need that support, I have to be able to get it, and I should not have to get it instead of, I should be able to get it in addition to. And so really understanding that the tiers are not a location, the tiers are not a person, and students do not belong to any tier, makes it so we understand what the vision is, what we're trying to build, what we're trying to do, and the importance of shared responsibility and working together in order to do that.